Let's discuss this further now with Dr. Helen Rees, who's a member of South Africa's Ministerial Advisory Committee for COVID and the COVID vaccine. She's via Skype from Johannesburg. Dr. Rees, very good to have you with us on the Al Jazeera News Hour. So, South African authorities made this decision to suspend the AstraZeneca vaccine, the data showing that the vaccine is, I believe, about 10% effective against the South African variant of COVID-19. So it provides no significant protection from what I understand, but the cases of the disease were mild or moderate according to the studies. So isn't some coverage better than no coverage at all?
It's a very good question. And I think the first thing we should say, because obviously we've heard from the UK, is that this vaccine is effective against other variants. So this was a very important study. It was a small number of people, and it was a young cohort, which meant that just in terms of the natural history, not many of them were anyway going to get severe disease. That means the only thing that it could show was that there's very limited impact on prevention of mild or moderate disease, but there weren't severe cases. So the question is, could this vaccine still have an impact on severe cases? And the other question being asked is, can the vaccine be tweaked to be responsive to the variant? And the answer is yes to that. And the third question being asked is, can this vaccine be combined with another vaccine so that you have two different vaccines that do what we call prime and boost? So you stimulate the immune system at two different points of time, and you do it with slightly different vaccines. So there are many questions still to be asked here.
Right. So why did the government decide to suspend the vaccine altogether?
Well, at the moment, because of the lack of efficacy, and it was a South African cohort, small as it was, it would have been very hard to justify putting that out to your highest risk healthcare workers in the absence of additional data. So we have a meeting today of both local and international scientists to ask the question, what is the additional data that we would need to see?
Right.
Fortunately, we're urgently looking to get hold of other vaccines. Two other vaccines have been shown to have efficacy against the variant. One is the Johnson & Johnson vaccine, and the other is the Novavax. And J&J did a sizable study in South Africa across age groups, right, and was able to show an effectiveness against the variant, but also against severe disease. So there are options that are being rapidly sought. So the actual rollout is not delayed, but it won't be with the AstraZeneca vaccine.
But in the meantime, you say it's not delayed, but in the meantime, you have 1 million doses of this AstraZeneca vaccine that are set to expire in April. What will the South African government do with them? Will they offer them to the COVAX scheme, to another country? What's going to happen to these doses?
To offer to the COVAX scheme would be very complex, because you would have to then be able to arrange a shipment to take them to another country. They would have to be lot tested in that country. Their quality would have to be controlled, which takes a little bit of time again. And as you say, the shelf life is limited. So I don't think that is really a practical or a feasible option. Instead of that, what we're doing as scientists and clinicians is we're saying, could we use these vaccines in a way that would generate data, for example, on severity? Could these vaccines be used and then included with a booster vaccine at the end? And could we use them, for example, for people who would otherwise not have access to a vaccine this year because of the limited supplies of vaccines? And while monitoring very closely for severity, for safety, to see whether, in fact, these vaccines do have a positive benefit for severe disease, and or whether they can be combined with other vaccines. So that is all very much under discussion. It's an urgent discussion because, as you say, time ticks very quickly with COVID.
It does. Thank you very much, Dr. Helen Rees, for talking to us about this.
Thank you.